Hi, it's Crystal Graham with Augusta Free Press, and I'm joined today by Harrisonburg Police Captain Jason Kidd. Hi, Jason.
Hi, Crystal. Thanks for having
So,
me.
yeah, absolutely. So, I know you handle a lot of mental health when it comes to the Harrisonburg Police Department, and that you've been with the department for some time. But recently in the news, Harrisonburg Police Department is looking to add a couple of mental health positions. I was hoping you could tell us a little bit more about that.
Sure. So we've looked at our calls for service, and we're constantly evaluating what types of calls we respond to, where the community needs us, and what is it they need us to do. And frequently, we see that mental health related calls for service are in the top five for our most frequent calls for service. And so, bearing that in mind, we were thinking about what resources we would need in place to best handle these calls. And one of the emerging best practices around the nation has been to have these co-responder programs where mental health professionals are paired with officers, not in an office, but rather in the field to handle emergencies and just really any crisis situation that may come about in the community.
So you're going to be adding these co-responders position, one to kind of oversee it, and then so like a licensed clinician, and then a qualified mental health professional. Are those positions already open? Are you guys hiring for those?
So we're currently in the process to select, to hire, and to select and hire our licensed clinician. And that's going to be either a licensed clinical social worker or a licensed clinician for and that will really help us out in terms of being able to get this program up and running, because what it's going to do is it will get us first, this licensed individual will allow us to have a supervisor, someone to oversee the QMHP, the qualified mental health professional in the field. But this licensed individual is going to be our clinician is going to be in the field as well. So that's the plan, that while they will be a supervisor, they're also going to be in the field, and they will be assisting officers on a regular basis to be out there on calls for service, and just to really help us to assess individuals, to help officers make the best decisions, and really just to have another resource out there in the community.
So I thought we could talk briefly just a little bit about what the process is now. I know that a lot of officers generally receive what's called crisis intervention training, which is kind of a broad-based um, training to respond to any kind of crisis, suicidal crisis, or anything of that nature. But these people, in bigger cities and that kind of thing, they have teams of people who usually go out, and sometimes law enforcement isn't even involved because, of course, a police car pulling up, especially to someone who's in a suicidal crisis, with someone with a gun, a holster, that kind of thing can be very traumatizing to someone who's already, under mental stress. So I thought maybe if you could just tell people who don't know a little bit about what the process is now without these positions for you all when you do respond to a call.
Well, when I've talked about this topic in the past, I'll typically mention that when we have a mental health professional out in the field, say, for example, you're going to have a licensed clinician, that individual has a bachelor's degree, a master's degree, perhaps even a PhD. And not only that, they've done all kinds of additional training. And so they've got years of training to be able to work with an individual who's in psychological crisis, or really any crisis for that matter. And when you look at the way it looks in practice for a police officer, who is typically called to these instances? And it's a police officer that gets this call initially. And a police officer typically would have, they may or may not have a college education. Many do, but not all. In the academy, they're going to receive a very minimal amount of crisis intervention training. So they'll have several days, perhaps, where they're going to be in the classroom learning about these topics. But then they're put into a situation where they're dealing with someone who's having on their worst day. And the challenge there is that police officer has to make split-second decisions with limited information and limited training, really. And so
Mhm.
we've really made a huge improvement over the last several years in getting more crisis intervention training to officers. But even in the best circumstances, an officer may have had 40 or 80 hours in addition to their academy training. But when you compare to what an individual in an office setting, most clinicians are going to be working in an office setting when a person has already been de-escalated. And so we're putting an officer in a situation that is it's really challenging. And so to put those officers in those situations without extensive training in these topics, it is a really tough situation. And so what we really feel is by pairing the officers with someone who really is that subject matter expert in the field of psychology or social work, that's really going to connect that officer with the resources he or she's going to need to make the best decisions in the field and really best assess the most favorable outcome for that individual in crisis.
I've talked to multiple law enforcement agencies over the years, and I think one thing that people don't realize is how much of law enforcement's time is really tied up, especially when someone has to go to the emergency room and maybe have some kind of, placement in a mental health facility or something like that. For people who don't know, could you maybe share a little bit about what that process is and how you all deal with
Sure.
that?
Sure. So we are frequently called out to situations where folks are not having a good day. And then that situation, that crisis that individual may be in, it could be due to any number of factors. And there's really no concrete way to define crisis. But an individual in crisis, for whatever it is that's causing that crisis, the individual is in crisis and they need help. And so officers may respond and they'll start assessing what the needs are. So talk to the individual, find out about what problems are taking place, what's causing the problem, what are the factors surrounding that problem. And a lot of the time when we find out that it's due to some mental health emergency, some type of mental health need, we're going to talk to the individual and find out how pressing that situation is, how acute of a crisis are they dealing with. And it may be in most circumstances, we'll find out that it does not require for the individual to get assessed in a hospital or just with some mental health professional. Many of the crises we deal with, we're able to de-escalate in the field and make
Mhm.
referrals to services. But there are many cases where we find out that an individual is in need of services. They're a danger to themselves or others. They're not
Mhm.
capable of self-care. Any host of reasons that really could put that individual in danger. And so in those situations, a key question is, are they willing to get help on their own? And if they're
Mhm.
willing to go get that help on their own, then we'll connect them with that source of help. In many cases, that's with a screen, with the going to the hospital and receiving that help. But in many cases as well, an individual might not be at a place where they're willing to get help on their own, and that's where the police need to step in, and we will actually detain them and connect them with a screener from the Community Services Board. We'll put them on
Mhm.
what's called an emergency custody order, an ECO. And what that is, it's a temporary hold for an involuntary detention, for an involuntary evaluation. So the individual has to go to the hospital. They'll be connected with a member from the Community Services Board who will screen them to determine if they meet criteria for a longer detention. That longer detention is called a temporary detention order.
Mhm.
Now, what we're finding is that these ECOs, as we refer to them, it could be that it's just going to be, say it's a several hour detention and an evaluation, and then when that temporary detention order is issued, the challenge where that arises is that there's not always a bed available
Mhm.
at an institution or even a private provider for mental health in the state. And with that temporary detention order, an officer from Harrisonburg could be having to take an individual to Petersburg, Williamsburg. There's a facility on the Kentucky border. They could be many hours away from Harrisonburg, and we actually need to drive the individual to that facility. That's if a bed is available. The challenge is when there's not a bed available, then an officer needs to stay with that individual while they're under that TDO, that temporary detention order, and it may be at our local hospital, but they would be staying with that individual at the local hospital until becomes available or until that order expires. And so that can easily be 3 days. So we
Mhm.
would be with an individual for 72 hours. And so during that time, we're taking an officer or officers off the street and they're staying with this individual in the hospital. And really, when you look at it, it's certainly not the ideal situation for the person in need because we really want them to get treatment. And during that time, they're not receiving a lot of treatment. And so really that's not the best outcome, but it is a better outcome than the individual just be put back on the street.
Yeah,
And
no,
so we'll stay with
absolutely.
these individuals.
Yeah. So, what do you think is the solution to that? As somebody who's in law enforcement, I know that bigger cities, sometimes have crisis receiving centers or places that you can take people where they have qualified individuals there and a police officer doesn't have to stay with them. But to my knowledge, we don't have that right now.
We don't right now. We do have a resource at the local hospital. We refer to it as our CTAC unit. And I, off the top of my head, I can't tell you what that stands for. I know it, but for whatever reason, I can't think of it right now. But our officer we can take individuals to the CTAC where there's actually a Rockingham County deputy who will be standing by to receive that individual and stay there with him at the hospital. So that allows us to put our officer back on the street. But outside of the officers, when the CTAC is open, or when a TDO is issued, then that becomes back in many situations it comes back to us. And so as far as what that solution is, if there were more available beds around the state, that would be a will be a when that happens, that will be a huge help for us because if there are beds available, it means we don't need to stay with this individual so long. We can take them to the facility, they receive the help they need, and we're out of the picture. But until that happens, we are stuck with the current situation of having to stay with individuals while they're looking for a bed. And that situation with the TDOs, that to me, that seems to be the key factor there, that there need to be more available beds. And so that's a challenge with staffing shortages around the state and around the country. That is a nationwide challenge, and that there's so many available positions. It's not that there aren't beds, it's that there's not in many cases there aren't staff available to help those individuals in need. And so that's why we're limited in numbers as to how many people can be served at these facilities. So that's definitely one major factor. And another factor, and what we're really hoping for this program to really come into play to help us fix, is so that we're making the best possible assessments and the best possible referrals. So if we have these mental health professionals in the field, we're really hoping that they can help our officers to determine when an ECO is most appropriate or when perhaps a referral to another service is the best option.
One of the things that I saw interesting in the job description was that you all hope to do some follow-up with people, afterwards. I'm assuming that's probably something that's very difficult to do now, but can you tell me a little bit about what your hope is for that?
Well, what I really hope for to happen, and we have some co-responder programs in the community already that really focus on follow-ups, and that's great that we see that the more if we have these follow-up appointments with individuals who may need these services, then they're less likely to be in a place where they have that acute need for services.
Mhm.
And so if we have an individual going forward with our co-responder program, the focus is going to be for those in progress emergencies. However, if we have an individual that we're dealing with say on a Monday night, and then our co-responder comes into work on, say, on Tuesday, then they may follow up and just check in with that individual, find out if they're going to their appointment, find out if they did make that follow-up phone call to the CSB or to some mental health provider to receive services, and also just to check in with folks. How are you doing? Are you taking your meds? Is there anything we can do? Is there anything you need? And just that those simple follow-ups can really make a big difference to someone to help to get them through that crisis time.
Now, you said that the department has already done some things that it could do before these funded positions obviously are in place. What are some of the things that the department has done in the last few years to kind of just beef up things, especially when it comes to mental health, substance abuse, those kind of calls?
Well, one thing we did several years ago is we established on each of our patrol squads, we have a position that is designated that we really try to funnel the mental health related calls to those officers. They have more experience working with those issues. Typically, it's a more senior officer. They've also received that crisis intervention team training, so the CIT training.
Mhm.
And by working with these types of calls for service, you really become more of an expert in handling those. And with that added expertise, we see more favorable outcomes. And so by funneling those calls we call them our MICT officers, that's mental illness crisis team, but really just officers who focus on these types of issues. That's one factor, one thing that we've done. We've also really put a priority on making sure that officers get CIT training. And so that's something that's important as well. By exposing officers to more of this type of training, it really does give them more of an appreciation for these types of needs and equips them with better communication skills and makes them more familiar with the issues that are present in the community related to mental health.
Perfect. Is there anything I didn't ask you about that you think it's important to share with our readers?
Well, I think that when we look at our co-responder program, the focus is that we're trying to put the mental health professionals in the field, and we've talked about that some already, but that really is the focus of our program. We are going to really put an emphasis on assisting with CIT training. We're going to put more of an emphasis on analyzing the types of calls that our mental health professionals are helping out with, and really trying to determine did it make a difference, so that we can evaluate this program and really just maximize its efficacy.
And I think I saw this was a grant funded position. So is this good through a certain period of time? What's the plan
It is
after that?
So it's a 3-year grant. It's a $550,000 grant over 3 years. Now, with that, for example, during the time that it takes us to hire someone, during that time, we're not, of course, not spending money from the grant period. So we should have leftover funds that we expect to be able to apply to an additional year. Once those funds have expired, during this whole time, we're evaluating how well is this program working. And at that point in time, when the program ends, when this grant program ends, we may be applying for additional grants. We may be seeking additional funding sources to hopefully keep the program going. And the key of that though is just to watch for the results and see how effective we are at improving our responses.
Yeah, I absolutely look forward to following up with you in about 6 months to a year to see how things are going and how it does improve things there in Harrisonburg. Well, Captain Kidd, I do appreciate you joining me today and sharing a little bit more about the program. And I wish you luck in the hiring, and we'll talk soon.
Thank you very much. Appreciate you interviewing me today, and I really appreciate the interest in this program.
All right.